everyone. My name is Sarah Reeves, and I will be doing a webinar today on how we can combat unemployment and HIV in South Africa. I've been working at the Aurum Institute for about a year now on an incredible program, which I will tell you much more about, and specifically how we can have a really solutions-driven mindset in solving problems in South Africa. My academic background is in policy, implementation, and development, and I think it's really interesting that I've found myself in the health space. And I think it's been so interesting to learn so much in the space of a year, and I really want to share more information with everyone about this. So maybe to start, I just want to speak a bit about youth unemployment and HIV in South Africa. So in our country, we have the highest levels of HIV and youth unemployment in the world, with 7.9 million people living with HIV and 56.4% of South African youth being unemployed. And I think what's really important in this conversation is that these two challenges that really burden our society are inextricably linked, and that young people really engage in high-risk activity, leading to high incidence of HIV. And I think something that's really important in our program and to mention is that young women between the ages of 15 and 24 are 4 times more likely to contract HIV than men in the same age group. So maybe just to tell everyone a bit about the program that we're running. So how it works is that in combating both HIV and youth unemployment, young people who haven't previously had access to any access to experience or further studies are given an opportunity to gain work experience in the health sector. So we place young people in facilities around South Africa, mostly in Ekurhuleni in the northwest, and then they gain their work experience by doing different roles such as HIV self-screening, lay counselling, or data capturing. And I think this is really important, and what's become more clear over the last year is that this isn't only about making targets for health implementing NGOs, but about empowering young people to know about HIV and taking that knowledge into their communities. So I think in combating HIV, what's unique about this program is it's not that an intern can capture patient files and contribute to what Aurum calls TX current, which is keeping patients on treatment, or lay counselors being able to test more patients. But it's about the knowledge that young people in South Africa now have access to. And I'll talk more about the really incredible people I've been so lucky to meet over the year. But I've heard so many interns say in their communities, they're the go-to person. And information that was previously inaccessible is now really accessible to more and more young people in South Africa. And maybe just in talking a bit more about the link between HIV and youth unemployment, there's a lot of really interesting debates. And although my role within the program now is more stakeholder engagement, in the beginning of the year when our team was smaller, all of us were doing all roles. We were training, we were developing content, we were placing interns, all sorts of things. And during that time, which is actually some of my greatest experience on the program, is to spend a lot of time with the youth before they start the program. And one of the really interesting debates about HIV interventions that came up during this time was around if young women are the most burdened by HIV, then how do we intervene accordingly? And it was so interesting how debates came up, and it was so gendered that young men in the room really thought, we should intervene with young women, and young women should be empowered and all of these things. And young women were really like, why are we not focusing on young men? And just to talk about and maybe to spark a bit of debate around how we should intervene with regards to HIV and youth unemployment, I was reading a really interesting study done on unemployed men, young men living in the Eastern Cape. And the findings were really interesting and I think really scary. And the majority of young men interviewed said, or it was found that their views were patriarchal and they were physically abusive to their sexual partners. Other findings were that men felt that they were discriminated against in their communities. And then, what comes with unemployment is drug use, and young men feeling like criminals in their communities and saying, I'm a good person and I do want to drive change, but because I'm on drugs, I'm seen as a criminal. So I think just to spark debate around how we solve problems, also to look at the repercussions on different demographics and how HIV is contracted. I think a really important debate when we talk about young women between the ages of 15 and 24 is a mentality around blessers, and that gender inequality in South Africa means young women don't have access to opportunities and then have sex with older men. And then this is really an avenue for young women to contract HIV. And I think really these debates are so important to have. And I think what's so interesting to me is where they should be had isn't necessarily on online platforms or in universities. It's with youth living in communities that are so burdened by HIV. And I'll get to a question that was posed to me soon that I thought was interesting. And I was asked to talk about how young people are affected by HIV at a personal level. And I really think it's so important that those sort of questions shouldn't be, I don't think I'm a voice of young people that are dealing with HIV. I definitely look forward to highlighting, some of the really incredible journeys that I've been lucky enough to hear. But these platforms should be in facilities with young people. And I think that's the incredible thing this program does. So I'm sure that there'll be debates through this webinar. And it's been really a great journey to be on this program, especially coming from a policy background. I think change is made when you empower young people to make change, not necessarily by even doing research or understanding what's happening on the ground, but by allowing people that understand where interventions need to happen to make changes accordingly. So I think I will try and address some of the really interesting questions that were posed to me by the Africa Matters team. So the first one is, Africa is predominantly young, reckoned as the continent with the largest population of youth. How are young people affected by HIV at a personal and societal level? And I think this is such an important question, and the comment comes up so much around the fact that by 2030, it's estimated that Africa's youth population will grow by 42% and will continue to be the largest youth population in the world. And there's two ways that this can be seen. The first is as an economic burden, that it's going to force African states, to pay out more grants, to do all sorts of things that will burden the state. But I think it's so much more constructive to look at it as an economic opportunity, particularly because along with population growth, there's so many more problems that need to be solved. And what's amazing with this program is it's this model that can really be looked at in so many different ways. So I think that's one thing that I find really interesting about that question, is to see young people as an opportunity to drive change on the continent, and specifically around HIV and awareness around HIV. So not just looking at numbers and targets and testing, but about how do we think about HIV? What does HIV mean in communities? And how those debates may be different than between people sitting in different spaces. So like I said, when I opened, I think HIV affects 7.9 million South Africans directly, and never mind indirectly. I think it affects a huge proportion of our population. And I've really been lucky enough to hear the most incredible stories. Over the year, I've spent a lot of time in the Northwest with an incredible group of young people who, have opened up to the team in various ways. And I think, it's important that a lot of young people talk about how kind of valuable the knowledge is, and to have knowledge about HIV and how they could or will change the circumstance of their family or family members affected by it. And I think what's been amazing is that we can generate this engine that can change a lot of lives and save a lot of lives in families that may not know a lot about HIV. And I think it's also important that, that young people have changed their perceptions about what HIV means to them. It's no longer something that they don't want to talk about or that shouldn't be spoken about. But if you spend time in facilities, the power of speaking about it really changes. And I know a lot of our interns now go out and speak loudly about HIV. There's interns on the program that have their own Facebook pages, one of which is on our team. And, he's an HIV activist. So I really think that given a platform, there's so much power in sharing information, which is really important. And then just to go on to the second question, you are currently working on a program that aims to eradicate HIV and youth unemployment through a one-year skills development program. And what does this mean to you, and what is your vision for this? So I think it's a really important question, especially as we work in a really tough working environment. But I think my vision for this program is that it should be managed and upscaled by young people that have come through the program. And although now I work with 3 incredible young women, and I think that we manage a strong team, I think what really strengthens this program is the ability for all 3 of us to, all 4 of us, to step back and let young people run the program and let young people shape it into what the powerful vehicle it can be moving forward. And, you know, hopefully moving on to the continent, I think, is another thing. Is I think that this model is so powerful, and to enable it to impact other communities in other countries and other diseases is so powerful. And I really think that it's got the potential to move past South Africa and really drive impact on the continent. But I think something, and my final answer for this question is that my vision is that we can eradicate HIV and youth unemployment in our lifetimes, and not see these things as a burden on society, but how can we interlink challenges in order to really solve problems effectively and allow young people the potential to solve these problems. And I think what's been really incredible about working on this program is that it's run by young people only. Most of the team is under 25. And I think that's so powerful as well, that this program can be initiated by a group of young people, and that young people can definitely continue running it without the need to have studied or to have a degree or to have a lot of work experience. I think that's really important. And then the third question is, if any, what is your experience dealing with youth who are interested in stopping the spread of HIV, and what are some of the solutions that have been used in the past to do this? So I think it's a really great question as well. And maybe to start with the last part of that question about what solutions have been used in the past to do this. Before I start, I think it's so important to look to the future as well. And one way that Aurum is really looking at this is there's something called a Pele box, and it was developed by a young man in Tembisa. And how it works is that instead of people waiting in long lines to receive their ARVs, which I think is a massive challenge in our facilities and a massive challenge to people staying on treatment and suppressing their viral load, is that it's very obvious in a facility who's there to collect their ARVs. And, you know, there still is a stigma around HIV and medication. And what this box does is it allows people that need to collect their medication to do so outside the facility. You put in a PIN from your phone and your phone number, and the box opens and you can take your medication out. So you don't have to go into the facility. You don't have to worry about how it may look, or if you feel like you know a lot of people at that facility. And I think this is a really great, innovative way that we can solve problems about how HIV can be spread. And also, I think I ought to bring back this discussion to the program. I think the program in itself is a solution, but I think it's also a vehicle to develop solutions. So I think that's what's so interesting, is it's not just what the program is or does. And I remember when we first started, I referred to our training earlier on, and when we first started the program, we were still developing the training, and everything was moving so quickly, and there were hundreds of interns coming in ready to be trained. And I remember that we were doing professionalism training, and I thought in a very hot room in Boksburg, and there were so many people there, and instead of having kind of a discussion and heavy slides, we ran this activity just without any preparation, and it worked so well. And it was about solutions. And the activity was, what are some of the problems that you experience in your communities? And we run this activity, depends if we're in the Northwest, sometimes we run it, but for groups to write down what are some of the things that they believe are problems that they see every day. And for groups to do this exercise and then to swap the problem, and for groups to then look at other groups' problems and develop solutions. And I think what's really important is that the program aims to develop solutions-driven thinkers. And it's not about a team of 15 driving solutions, but it's about the fact that we now have 830 people that are able to think in a solutions-driven way. And we did this really great exercise at Microsoft around how can we leverage technology to develop solutions. And some of the things that interns were saying were so interesting, whether it's app-related or having medication delivered to your doorway, and kind of echoing things that were also being developed in other parts of the continent, like in Zimbabwe. And if we give young people that opportunity to develop solutions, but also to be able to implement them, it's so important. So in answering that question, I think to look forward rather than the best ways that HIV has developed in the past, and really allow young people who work in facilities to develop solutions and implement them, which is what I think is really important. And I think on this point, what's really important is how we talk about youth participation, particularly, when we have such a big platform of youth, is that are we engaging young people and asking them what they think, or are we empowering a generation of young people that will be decision makers and will be able to change the way we address HIV going forward? And I really think that that's the power in the program, is that it's a platform. It's not necessarily that it is an internship that gives people work experience, or that it may allow for a springboard to other job opportunities. But I think it's a platform that allows young people to really have this space where their opinion is so important. And I think our hope going forward is that we also have a really big platform on social media, that we can push ideas forward, that our interns can use our social media to leverage their own ideas. And for us to go to Aurum and say, you struggle to reach your targets, but why not speak to all these young people that have worked in the facilities? They know what's wrong. Why not ask them how to fix it? Because I really, really believe that they know how to, which is really important, and it's been really amazing. And then the fourth question, how can HIV not be seen as a menace, but as an opportunity for employment? I think this is really interesting as well. So I think how I'd answer that question is, I read a really interesting fact published by the World Health Organization, and they said by 2030 they'll need 4.2 million people in the healthcare sector to meet their targets. So when there's a need for that many people to enter a sector, and there's also this huge growing youth population, and never mind in other sectors where people are needed to reach healthcare, whether it's healthcare baselines, education, which is another way that this is so important. But I think if we need these people to work against HIV, and there's young people that just want an opportunity to work, I think they pair so well together. And I think this goes far further than a year from now. And so looking at the next decade about how we really solve problems, both that are going to be around for a long time and that we're currently experiencing. And I think another really interesting part of our program that we've been exploring, and I think there's so much more room for growth, is around education. And I think it's still so interesting how the Department of Education and the Department of Health interact. And I attended a short course on youth and health policy at UCT, and it was so interesting. There was a lot of really experienced people from the Department of Education, and there's still so many roadblocks in schools. You can't talk about sex, or a lot of teachers don't like to talk about sex or talk about safe sex. And I think where there's also so many opportunity, and not seeing HIV as something that's so scary, is if we can change how schooling looks, how sexual education is taught in schools. And I think this also really opens up more opportunities for young people that can mentor, young people that can be peer facilitators. So I think in looking in a more multifaceted way and not seeing HIV in a silo within the health sector, there's so much opportunity for growth within that, especially considering how many more people we need working on the ground. And the fifth question is, what are some of the community perspectives that may be a hindrance for youth who want to work with people with HIV, and how do we overcome that? So I think just to start, and what's really important is there definitely is still stigma attached to HIV. I think that you see it in that a lot of the concerns the youth on the program have when we speak to them is that how do you deal with the fact that you may know people's statuses and a status of someone that you know well that's coming into the facility, especially because our interns and what's a really big and something important to the program is that young people are placed in their communities. So they don't have to travel and they're familiar with the facility. But what that means is that young people now know the status of people living in their communities. And I think that this is a concern that a lot of young people have when they start their work experience. And I think in overcoming this, what's really important to note is how seriously interns take the issue of confidentiality. And it's not something that's dismissed. It's not something that young people don't care about. And it's trusting that young people will safeguard this information. And although communities may be apprehensive about having these young people in the facilities, how we can change this narrative is really by emphasizing how important the issue of confidentiality is. And I remember speaking to one young man on the program, and he was talking about the struggle that he had seen someone's status, and it was a friend of his, and they were playing sport, and all he could think about was this, and he just wanted to say it, and he wanted to tell someone, and it was just all he could think about. And they carried on playing this game of basketball, and eventually he was like, that's not right. And like, it's weighing heavily on me, but you know, it was really something that he didn't want to share. So although communities, I think, may be concerned about how young people interacting at the facility level may affect statuses being known, I really think it's important to note that young people who gain access to this knowledge don't have. That's okay. Sorry, everyone. Someone just came into the room. But I think that it's really important that young people keep information confidential. But I think that, again, just to bring back the discussion to awareness, is that once we're able to talk about HIV differently and change the narrative, it changes how communities may perceive young people working in facilities. And I think a really incredible initiative that we've implemented to do this is Youth Drive for Health. And I think, I don't know if we can speak about this program anymore without speaking about this campaign, where over 4 events we've been able to test almost 3,000 people. And I think that's really powerful. But also that you don't have to go to a facility to be tested. It doesn't have to be scary. You don't have to be alone. You can be with your friends. There can be music. There can be dancing. And that doesn't mean that if you are tested positive, you don't get the help you need. You still get that support, and there's clinicians at these events. But that it doesn't have to be something that's really scary and a really big secret, but rather a way to be in an environment where testing is more accessible. So I think having campaigns that run by youth for young people is how we can really change how communities see HIV and see young people who work with HIV. And I think that's a really important part of the process. And now, I don't know if there's any questions. Oh, I've got questions from the audience. So one of the really great questions is why do you think an intervention like the Aurum Youth Project is not well known around various communities in Africa. So I think that's a really interesting question, and I think it's also about understanding that the program would have to be adjusted in some ways to move it into other parts of the continent, and that I think it's not something like maybe in Malawi you'd want it to be more geared towards malaria or something specific. So I think even as the program moves into the continent, and I really think it has the power to, it will definitely be adjusted in different countries. And I think another huge reason is that if this program works in other parts of the continent, it definitely won't be this team taking it there. What's powerful is that another team in Malawi can develop a similar program using this model, and it's run by people living there, hopefully young people coming off a similar program. But yeah, I think that's what would make it powerful, and I think maybe that's where there hasn't been a transfer of information yet, is that it has to be picked up and have buy-in from young people in other countries. And then I've got another question. Is this a program that can be replicated for different diseases? I think I did touch on that, and I think it absolutely can, as long as it's developed by young people in those countries, and not kind of taken into not taking our team and our program somewhere else, but rather watching it grow from a very small number in other countries. But yes, I definitely do think that's possible, and I definitely do envision that. Where can we get more information about Youth Drive for Health? So we're super active on social media, and it's been so fun over the last kind of 5 weeks learning and sharing our event. So you can follow the drive on Facebook, Twitter, and Instagram at Aurum Youth, and on Facebook it's Aurum Youth Project. But definitely follow the program. It's so exciting. Next week we'll be in Rustenburg for our event, and then we'll be in Klerksdorp, and then back in Ekurhuleni. And definitely for anyone watching this to come to the events. It's so much fun. And it's really great to see how you can change, or how young people can change the narrative on HIV. But if there's no more questions, I think I will wrap up. Bye, everyone. Thank you so much for listening. This was so exciting. And thank you, Africa Matters. The Africa Matters team was so incredible. And maybe one last point, I really think that in moving the program into other parts of the continent, organizations like Africa Matters are so critical in the platform they have, and the amazing team they have all over the continent. So looking forward to more work with Aurum.